4-year-old Tatiana, both African American, both born with sickle cell anemia, essentially a dangerous breakdown in the genetic code
that causes red blood cells to lose their shape, and they become sickled. They look like crescent moons. And these sickle cells then have a difficult time getting through, wiggling through small blood vessels, so they get clogged there.
Toddy, as she's affectionately known, was so sick from sickle complications like lung, kidney, and bone pain, she was in and out of the hospital 14 times before she was 3.
That phenomenon causes pain, it causes organ dysfunction, and it causes significant suffering. It can really take them away from living a very normal, healthy life as a child.
As for Quentin,
he had to get a blood transfusion every 30 days because it was a way to prevent him from having a massive stroke.
At just 7 years old, at risk for catastrophic stroke.
The blood vessels leading to his brain became very narrowed because they were getting scuffed up by these sickled red blood cells.
Well, that was then. This is now.
You want me, Quentin?
Because little sister Sheila saved him. A perfect bone marrow donor match for a promising transplant procedure at university hospitals. First, chemotherapy wipes out sickle cells.
If you transplant a patient with sickle cell disease with healthy bone marrow cells, the blood stem cells will then make very healthy red cells.
Today, Quentin is sickle cell free.
And it seems like after the bone marrow transplant, he wants to go outside, he wants to ride a bike, he wants to play with other children.
Toddy on the mend as well, thanks to a donor she and her family didn't even know, who donated bone marrow through a procedure Dr. Ken Cook says is relatively simple.
It's done in the operating room. The donor would be under anesthesia, but then the recovery time is actually quite short. Most adults are back to work in a couple of days, and most kids are running around later on in the day of the procedure.
And when the procedure takes, like with Toddy,
she's sickle cell free.
Which is more than Toddy's dad can say. At 30 years old, he's fought sickle cell disease his whole life.
Man, it's sharp pain. Sometimes it can be all over your body.
This relatively new procedure, done on young patients at Rainbow Babies and Children's Hospital, not available when Dad was diagnosed as a baby.
Well, it is going to be different with her because her match went through, so she no longer have it. That's a great thing. She can live a good life like everybody else.
The problem is African Americans are predominantly diagnosed with sickle cell anemia, but there are so few African Americans like Sheila here who are actually on the bone marrow registry.
If we didn't have this bone marrow registry, my child wouldn't be able to be cured from sickle cell.
It's not that difficult.
You don't even need to donate blood. It's really a cheek swab, so we can get some of the genetic code from the lining of the inside of our mouths.
And if my 7-year-old can do it, what age can't do it? If she was able to do it for her brother, why can't you?
Want to know more about being a bone marrow donor? You can check out www.bethematch.com. I'm Dawn.